And we are live. And so I'd like to introduce Dr. Sonia Chopra. You are located out of Raleigh?
Charlotte.
And she is, since you have an online platform and the internet is worldwide, I'm going to call you world-renowned endodontist. With a very fast-growing online curriculum CE platform that we're going to get into some detail on. Very excited to have her on today. She is actually works with my business partner, Reagan. And so we're going to get some secrets and the goods and the bads of Reagan, hopefully. Get some good information there. But how are you this morning? It's a pleasure to have you.
I'm doing great. Thank you so much for having me. I'm excited for this.
I am too. We scheduled this, a couple of weeks ago. Reagan had sent me an email, says, hey, you got to have her on. I said, yep. Gladly, happily. And then reached out to you. We got it scheduled and here we are, 7:30 in the morning on Wednesday.
Awesome. Love it. That's how I like it.
I like it. Good. Cool. So I think one of the questions I was asking before we started recording was Vivek. That's your husband.
Yep.
And he's a general dentist and he's also in Charlotte.
Yep.
Yeah. Do you
thankfully, right? Otherwise, right? Wouldn't see him much.
That'd be hard. You guys practice together, right?
No. God,
okay.
no.
Okay. So
definitely
y'all have
apart.
Two separate practices.
Yeah.
I was thinking y'all were under the same roof.
No.
For some reason.
No, I don't know if we would be married still, but
I gotcha. Fair enough.
We're doing good. We're doing good now.
Good. Very good. I don't know. There's a lot of husband and wife teams out there, right? And it might be the husband's the dentist and the wife's the office manager, or husband, wife, dentist under the same roof. And I've always kind of been curious how that works. If that's
I didn't even change my last name because most people, being a specialist, being an endodontist, and my practice is referral based, I wouldn't be able to get any patients if I was under the same roof as him, and I was pretty sensitive about the last name thing. And so I didn't even change my name after we got married because I wasn't sure how people would handle just that.
Right.
People still are a little weary that, he's referring patients to his wife. Sometimes, not everyone. Some people enjoy it because they like him and, they trust him enough. But other people think that there's a little bit of an ulterior motive. So for me, I just wanted to keep it separate forever. And I think when I retire, I'll probably have a name changing party that everyone can come to.
Right. So it's the fear that because he's your husband, that let's say I'm a general dentist and I'm across the street from him and I send you one of my patients, that you might redirect that patient to him.
Correct.
Yeah.
Correct.
Yeah.
Yeah.
Interesting. Yeah. I don't know that there's a way around that. I understand where the fear comes from,
Yeah. But I mean, I had to, in the beginning, build my relationship with my referring dentist so that they knew that would never, ever happen.
Right.
And then I could introduce him as my husband.
Right. Interesting. Yeah. Cool. So how long y'all been married?
12 years, going on 13, but we've been together for 18.
18. Oh, so you did a Reagan and Chris kind of a thing. Because they were together for like 8 years before they.
I am married to a high C.
Yeah.
Okay, and that means that decision took a long time for him to process.
And he finally pulled it. I don't know. I've got a C component in my personality too, so I kind of understand where that comes from. It's kind of like you want to make the right decision, right? But you overthink it.
Oh gosh, the analysis paralysis is a lot for me. Who's a D? It's a lot for me.
Oh wow! So y'all were. That's an interesting combination there.
It can be challenging sometimes.
Yeah. I was an SC earlier in my career, and over time I've adapted my D. The last 2 consecutive years I've been a DC on the disc. And so I told Reagan that's why nobody likes me, because I know I'm right and I'm not afraid to tell people I'm right.
Yeah. I just changed to a DI, but I'm a DIC. I tell people I'm a dick.
Very good. I like it. So yeah, I bet you, I bet the communication between the two of you two of you's pretty interesting.
It is, because, like even when you look at his Enneagram, he's just that quiet thinker.
Right.
And I'm like a hard 8. Like, I don't think before I speak.
Right.
So we're complete opposites.
Very good. Well, they say opposites attract, right?
Yeah, that's
and
true.
You have 2 kids?
I have 3 kids.
3 kids? How old are they?
I have a 10-year-old girl, an 8-year-old girl, and a 5-year-old boy.
10-year-old girl, 8-year-old girl, and a 5-year-old boy.
Yeah.
Any sports?
No sports yet. We're trying to get them into something, but yeah, my girls are really girly. They would never do sports. And then he's pretty athletic, but with COVID, I just haven't been able to get him involved in anything.
Yeah. If you do yourself a favor, if you want to have some fun, put him in baseball.
Oh yeah. He seems to really like that the most.
Because my nieces and nephews are in coach pitch.
Mm-hmm.
My brother invited me out to kind of help coach some of the practices. And I've never seen such organized chaos in my life. It's like you could tell him, he will tell them on every play what to do. And then he'll hit the ball and nobody moves. And then like if somebody hits the ball and they throw it to first, like it's so easy for a routine grounder to the pitcher to turn into an in the park home run because they'll throw it over the first baseman's head. And then the first baseman will throw it over the second baseman's head.
That's so cute.
And I was like, I would just instruct all of my players if I'm batting, I would just instruct all my players, if you hit the ball, just start running and don't stop until you cross home plate.
Yeah. That's a good strategy right there.
by the time they throw it and then drop it and then pick it up and then think about it, then go to the base, you're already at the next base. Just take up running and don't stop.
Oh, that's just, I would love to watch that. My son's starting flag football in a week or 2.
That'll be fun. Yeah.
Yeah.
That'll be fun. So let's talk about your practice. So you've got a specialty practice in Charlotte.
Yep. It was a startup.
That's what I was going to ask you. So it was a startup. And then how long have you been in practice? When did you start up?
I opened my practice on my birthday in 2008. So right when like the economy tanked, I opened up shop and everyone was fearful for me, but I was like, well, I don't know any difference. I don't know like anything but slow. So I was like, the only thing I can do is go up from here. So it was actually for me a perfect time to open. So it's been, again, 12 years going on 13 years of practice.
Yeah. How was it? Did you just like hit a home run coming out of the gate? Did you struggle for a few years? What did that process look like?
I guess you could call it a home run. I don't really know what to compare it to. I remember I moved here in June of 2008, and then I opened my practice in December of 2008. And during that 6 months when it was like construction time, I was just out and about meeting everyone. I went to like every dental society meeting. I just showed up everywhere. And so people couldn't get rid of me. And then they're like, who is this new person? And I opened on December 18th, which is my birthday. And that is the week of Christmas, which is a great week to open because people are trying to use up their benefits and people have emergencies and everyone was packed. So I basically marketed myself as like, hey, send me your emergencies. Try me out on an emergency. And my first day, I actually had 6 patients. Okay. So I thought that was great. And so, like from where I started and moving to Charlotte, North Carolina, I had come from South Florida because that's where I did my residency. I mean, I didn't know a soul here. Mm-hmm. And to be able to just grow your practice from like just walking into this new life, mm-hmm. I think that was pretty remarkable. I look back, I'm like, I don't even know how I did it.
Right. That's fun, isn't it? When it's like, it's when you're in the moment, it seems like time goes slower.
Yeah.
I think, hard moments, it seems like time goes slower.
Yeah.
But when you look back, you're like, it's like it was a flash and it's gone.
Yeah. Yeah. I can't even like Like I know I put in a lot of like after hours work because, you know, as a specialist, you have to make relationships. Your job doesn't end when you're done with clinical care. You've got to find the work. And luckily I was just newly married. You know, my husband was still having boys' nights and stuff and like having fun. So I took that opportunity to just go out and meet people.
Mm-hmm. Where'd you go to dental school?
University of Maryland.
University of Maryland. Is it? And you said you're from Florida?
No, I'm from New York.
Okay.
I did my dental school at University of Maryland, and then I did my endo residency down at Nova Southeastern University, which is in Fort Lauderdale.
Okay, so you're a halfback.
Yeah, I sure am. Yeah.
I just learned that term not too long ago. But for those that don't know what a halfback is, it's the people that are from the Northeast that move to the South, and the South is too hot, so they move halfway back.
Yep.
And so that landed you in Charlotte. So there's actually, I think the population in Charlotte, there's a lot of people there from the Northeast. It's kind of like
a ton. And I think now after COVID, everybody wanted to leave because, you know, the weather stinks and we're just close to a lot of beaches, mountains, all that good stuff. So it's just become a really popular place. You look at the real estate market right now, there's like no inventory for homes. Yeah. So I really did a good job on picking a place. My husband's family is all here. So that was our reason for coming back. But I did not think that Charlotte would grow in the way that it's grown over, you know, the 12 years. I lived in New York City. I lived in Baltimore, DC, and basically Fort Lauderdale, Miami. So like I had like big city vibes in me. And when I moved here, I was like, oh my gosh, there's nothing here. I basically can go to dinner at a Chili's, and I was really upset. Like it took me a while to really come to terms with that. But now I call it home, and I'm so happy that my practice is here, that my life is here. Mm-hmm. When I was doing my demographics for my business plan to open my practice to get my loan, I remember in 2008, like 33 people a day were moving to Charlotte. Mm-hmm. And now I feel like that's doubled.
Yeah, it's probably higher than that now. Yeah.
Yeah.
Charlotte's one of the fastest growing cities in the Southeast.
It's insane.
Yeah. I think actually Charlotte's one of the fastest growing cities in the country. Mm-hmm. Nashville is up there pretty high. Mm-hmm. The last time I looked, I think it was Houston, Texas was the fastest.
Oh, wow.
At the time. But if you've ever been to Houston, it's insane. It's like they can't build the infrastructure fast enough to keep up with the growth. It's ridiculous. Cool. And then is Vivek, did he acquire practice or did he start up?
He bought in.
Okay.
So yeah, his partner, lost his partner. He moved or something. I don't know what happened, but then Vivek rolled into that position and then bought in. And they were 2, and now there are 4 doctors there.
Interesting. If I'm not mistaken, he went to dental school with like Dr. John Becky and Dr. Porter and all those guys. Those are all Reagan's folks. I don't know very all the Charlotte people. That's Reagan's. That's Reagan.
I don't know
over there.
Like I said, he doesn't communicate much. I don't know.
Very good. How was the startup process? Like I'm very, I don't know if I've got one specialist, a periodontist down in Atlanta. And she has acquired a few practices and merged them in. I would encourage someone to acquire as opposed to starting up, just because I feel like, especially right now, because there's a lot more dental practices than there are dentists. Mm-hmm. And so there's acquisition opportunities abundant. Plus you've got people that are, you know, the baby boomers are kind of leaving the market. The millennials have come in, and some of them are just that demographic is just not as prone to business ownership. And so there's a lot of ownership opportunity. And so I think the startup route is pretty tricky, you know, because if you don't get the numbers right and you wind up underfunded, it could really put you in a difficult spot. Right.
I think it depends. There's so many variables, and I think it depends on even your own personal situation. Like
Mm-hmm.
I was fortunate. I was married to a guy who I could depend on, you know? So if you're the sole breadwinner, it may be a different story. You know, if you have all these loans coming in, you have a family. Like I didn't have a family yet. I just had my husband and I could live off my husband. So the first year I actually didn't take a paycheck and I could do that. So, but I know not everybody can do that. So I think it really varies on that. Plus your personality. Like I have a personality where I needed to have it my way or no way. So the way it was designed and like, this is going to be my baby. And I needed, as a control freak, I needed to have the control over that. So some people don't care about that. They just want to have patients to start on right off the bat, right? So I think there's a lot of things to consider when making that decision. And if you're okay, maybe moving your practice to a different location after you've been established, you can also do that too if you need to get what you want. So there's a lot of ways to look at it. I really felt like the way that I did it was how I was meant to do it.
Yeah. And your personality style too, I think is very, you're like pre-engineered to be a successful entrepreneur, right?
Because that's really kind of you.
Well, the D facet of your, studies show, right, that D-type personalities are much more effective entrepreneurs, especially D-type personalities with high emotional IQ. They're more entrepreneurial by spirit. They're risk takers. They're decisive. They take action, right? And as an entrepreneur, those behaviors are necessary to be effective and successful. So
I will agree with that, but I will say I don't think I was always like this. Like, you remember how you said you were an SC and now you're a DC? I don't know. I didn't know what the disc was back then. Like, I didn't know any of this stuff. And so I don't really know what I was, but my husband tells me all the time, like, you weren't always this way.
Right.
I've definitely grown into this personality. And sometimes I'm happy about it. Other times I'm like, man, I kind of wish I was softer or whatnot. Like, I've had to become a little hard as a result. And it's now my driving force, and it's now my default, and that's okay.
Roger. Well, how's your team? You got a good group of people in place?
Finally.
Yeah.
That was my biggest struggle. Because they don't teach you this stuff in dental school. They really don't. It is not even like, I complain about how little they teach endodontics in dental school. They teach zero business. They teach zero communication. They teach nothing. And that's a shame. And they really need to put this in the dental school curriculum because it will help so many people just fast track their success. I opened in 2008. I did not start actually becoming intentional about this until 2016. And I literally had to hit rock bottom. I was on the verge of burnout. I was like, I cannot believe that this is what I studied my entire life for, to do this. Like, I hated practice ownership. I was ready to give away the keys. And part of it was, I grew and I couldn't keep up with the growth because now I'm 3 doctors and I could not do that. And I couldn't. And I have 3 kids, 3 doctors and 3 kids. So all of that happened at the same time.
Okay.
And I really didn't give myself any grace for it. And when you're like 40 weeks pregnant, because I never went into natural labor, I always had to be induced. So I worked until the very end of that, pregnancy every single time. And you don't realize what your body is going through. You don't realize how you're communicating with others. You're just going, you're just doing, and you don't even realize what you're doing. And that's how I practiced for 8 years. My bedside manner was great. I was great to the patient, but I would get so frustrated with my team. And half of it wasn't even their fault. Half of it was the fact that I didn't even have any systems. Like, nobody knew what I expected of them. because I didn't take the time to outline that. And I just kept on blaming others, and people don't like that, right? That's when you lose your team members. And I just had turnover after turnover after turnover. And I'm like, something's got to change. And the common denominator was me. And that's where Reagan came in. And that woman can really shine that mirror back at you and say, hey, listen, we got to start with you first. If you want everything else to change, you got to start with you and look within. And that's where my personal development journey began. And that's when I started to see big change in my practice, like big change, not just with my team. It was from a revenue standpoint. It was across the board. So thanks, Reagan.
Yeah, that mirror is uncomfortable. You know, it's I think human nature is to avoid looking in that direction. You know, it's almost as if we want to find something or someone that's responsible.
Yeah.
But, you know, one of the things that we that we advocate and coach is the idea that, you know, if you give away responsibility for the results that you don't want, how do you take responsibility for the results that you do, or credit for the results that you do want? Right? If it's not your fault when it goes bad, then it's not your fault when it goes good either. Right? And so we've got to accept responsibility of all the results, good and bad. And one of the things that's the common thing that's come up on several calls here recently, came up on the one that I had this morning before you and I jumped on, was taking things out of the context of good and bad or right and wrong. Right? It's kind of like, you know, if somebody's being coached, it feels like I'm bad or I'm wrong or I'm not good enough. It's all that kind of stuff. And at the end of the day, it's really not good or bad or right and wrong. I think we've got to learn how to take things out of that context and just accept that it's not about right or wrong or good or bad. Is it working or not? That's really what we're trying to figure out. Is it getting me what I want, or is it not getting me what I want? And if it's not, then change it, do something different. Yeah. Right. So it's interesting. So you've been with Reagan since 2016?
I'm pretty sure. It's been a while. Pretty fun. Yeah. And like my team, I would say most teams are resistant to coaches, you know, or consultants, whatever you want. I call her a coach because I think that's what she really is. I think she's really unique in that she understands people, but she also understands the business of dentistry. And the two things combined are what like really catapult the practice growth. My team lives for our quarterly like offsite meetings where we get together and we learn with each other. And it's almost like at the 2.5 month point, like we all get this like this irritability and like, okay, we need a reset. We need a Reagan reset. And then we go have our meeting and we fall in love with each other again. Yeah. And there's like tears and hugs and it's really beautiful. And if I told my team we're going to stop doing it, they would be probably really upset because they see now that it's not, they're learning so much that they're applying at work, but they can also apply it in their personal lives. Yeah. So when we do our reality checks and our quality requests, like they are not just doing that at work anymore. They're taking that home. They're doing that with their husbands. They're doing that with their children. It's just across the board, and they're just becoming better humans as a result. Yeah. And all of their relationships are getting better, not just at work. So it's not to sound sexist, but I feel like she's able to connect with her teams in a way that I can't. Like, I don't know if it's her personality style or her approach or the fact that she's a woman, but she can, I mean, because the vast majority of dental practice employees are female, right? And so she's able to like get on their level and get and establish a level of rapport with them that I feel like I have great relationships with my teams, but it's almost because I'm a guy, you know, it's the dynamic is different, right? And so I'm a little. It might be her delivery because like she has this particular face that she'll give, and you know she's being harsh, but there's also a sense of just like funniness that goes along with it, but like she's totally serious. Like, and you better listen to her and look right here. Very good. Yeah.
So you brought Reagan on, you hired 3 new coaches or hired 2 additional doctors.
So here's how it went down. Actually, we were growing. Okay. I had my first baby and had a few medical issues, and my maternity leave was horrible. I basically had 2 weeks and that was it. And then I would have to go and spend a week in the hospital with my daughter.
Mm-hmm.
And I had to do that 3 times. And my practice was hurting because of it. So I knew that I couldn't do this by myself. And so I knew I had to get another doctor. And so I brought in Mark, and I thought, okay, that's going to answer everything. I'm not going to have to do all this by myself. But his transition from being an associate to an owner was tough because he really just practiced as an associate for a while. And I was like, hey, I'm giving up 50% of the practice to give up 50% of the work. Like, I don't want to do it. And so that was a huge battle. So when Reagan came in, me and my partner were about to split. Like, right. It wasn't a good love story at all. Reagan has since succeeded in saving our relationship, and really allowing both of us to divide and conquer properly. And then we've grown more. And the 3rd doctor came in. I had another associate in there for a little bit to cover my 3rd maternity leave, but that was not a good match. The core values weren't aligned. Mark and our core values are very much aligned. Mm. And I lucked out on that because I didn't really know. I didn't take time to learn my core values when I first met him. I did and I didn't. I went with my intuition, which is typically right. And I brought him in, and we're a very patient-centered practice. And he said all the right things. He didn't want to just pay off his loans. Like, that wasn't the reason why he wanted this job. He really wanted to take care of people. And that he was the only person in 2 years of meeting candidates that actually spoke with that language. And so I knew he was the one. But we had to figure out a way to really work with each other. And I think that's a big adaptation for any owner. You know, it's easy to say it's harder for the associate to come in, but there's a lot that the owner has to go through. You know, when Mark's name got circled on the referral slip and it was no longer my name, that was like harsh. That was like a big thing that I had to learn to just sit with and realize that it's okay. Mm-hmm. And I had to remember that, you know, I need him. My happiness is with him him in my life. And that means I'm going to have to share my practice, which for me was a big adjustment. But I thought that all my problems are going to go away by just having another doctor. And that's not how it went down. And we had to really work at it. Just like any marriage, you have to work at it. You have to work at your partnership at your office too. And then now we have Tanya, and she's another good match, and she's going to be buying in as well. So very
good. Is she going to be buying equity from both of you, or one of you going to?
We want it to be even. Yeah.
I got you. So you said you were 50-50 in your partnership?
Correct.
Did that create any obstacles, like when important decisions come around?
Like I said, it's weird. We're really aligned, but he's very much like my husband, like personality wise and all that stuff. It's funny how I pick them. Like, they're literally the same. But we typically don't disagree. Like, we always want this cone beam, or we want to, you know, add the gentle wave, or, you know, we just want the same things. And I knew that in my initial discussion with him when I first met him.
Interesting.
Yeah.
Interesting. So now so Tanya came in, and now everybody is a third?
She's not an official partner just yet. We're working through that. We're working through that now.
I got you. Interesting.
Yeah.
Let's go. What kind of geography or radius do you guys pull from being in Charlotte? You pull like an hour away, 5 hours away?
I would say like we're in South Charlotte, so we can pull from North Charlotte, which is a good hour away. Yeah.
Okay. Okay. What would you say being in a partnership? Because a lot of people that will see this are either sole practice owners, they own 100%, or maybe they are in a partnership, a majority minority partnership. What would you say, just in your experience in that arena, what variables would you say you've learned are the most important in building a successful partnership?
Communication is number one. Mark and I have a really good transparency, like, especially when it comes to money. Like, we won't even move $1 without talking to each other. I think that's huge. We do not make decisions without consulting the other. So communication is really key. Transparency is huge. Vulnerability is huge. Being able to say what we need to say to each other. Let's see, what else? Those are like the big ones. But again, when you know your core values and you really understand them, that's how you pick and choose your people, right? And if you know that before you do anything else, you will save yourself a lot of time and headache, whether it's your partner or whether it's the rest of your team.
Right.
And then I think having a deeper understanding of everybody's personality type, because it's one thing to communicate, but it's also like I said, I'm a hard 8 when it comes to the Enneagram, and I am a hard D. And that can be a lot for like an S. It's a lot for some people, but the more and more we all take the time to understand our different personalities and identify each other's strengths. Like, some people may say, so-and-so, this is their weakness. But actually, if you spin it around and look at it differently, it turns out to be their strength. I always say this. There's this one team member, her name's Kendall. She gets a little stressed over time and putting emergencies into the schedule. And as an endodontist, we have emergencies all day. But she's actually really good at seeing in the schedule where we should put that emergency so that the patient doesn't have to wait, so that the team can all get lunch. There's no backup on the rooms. Like, we turn that complaint from everyone who said, oh, she gets anxiety over the schedule, to her strength, because now everyone goes to her, say, okay, where should we put this patient? And so that's just one example of one person on the team. But when you really focus on everybody's unique abilities and you start to work with them, whether it's your partner or your team, then that's kind of where the magic happens. So I think it's really important to understand everybody's personalities and strengths too.
Yeah. Would you say that developing a better understanding of yourself helps you to better understand others?
Absolutely. Because I think nobody had like an awareness of themselves first. And then when we started to embark on this journey of understanding these different personalities, everyone felt a little bit more understood. And then we all developed this awareness of how we are and how we show up. And then once we have that awareness, now we can make changes in order to adapt in certain situations.
Interesting. I've always said that I think the most important thing, I think the quality of relationships are a direct reflection of mutual prioritization. It's like, if I'm by myself, I'm not married, I don't have kids, there's no one on my team, right? It's just me. Then who's to say, well, you spend too much time at the gym? You know what I mean? It's like, my priorities are the only priorities that matter, right? Yeah. But if you're in a relationship with another person, or a bigger relationship on a team in a practice, now it's about everybody's priorities. Yeah. And do we prioritize? Are our priorities mutual? Is what's important to me important to you?
Right.
And I find that that's most often where the upsets occur, right? So we know that most upsets are rules upsets. So my rule says that this is how we prioritize time, and you're prioritizing time differently than I am. And I disagree with how that's being prioritized. So that's where the dissension and the upset comes in. It's because priorities aren't mutual. It's interesting.
Yep.
It's very interesting. Awesome. Okay, good. And then, so as if you didn't have enough on your plate with 3 kids, a husband, 2 associates, or 3 doctor practice, pulling patients from an hour plus away, you decided that you need a little bit more to do?
Yeah. So one of my core values is growth. And I felt like I had more to give to the world than just what was in the 4 walls of my practice. And this actually started to come out as a result of me getting a better grip on my practice, if that makes sense. Mm-hmm. So being able to change my team culture, my whole practice culture, allowed me to trust people, to take things off my plate. And when I was able to delegate better and get rid of stuff that I normally would do and get kind of caught up in the admin and working on the business stuff, I actually created more time in my life by doing that. And so with more time, I now was able to start dreaming about my vision and what I really wanted to do and what I wanted to be in this life. And that's kind of where eSchool was born, because I saw a need in my practice every day that there needs to be more endodontic education out there, because patients were coming to see me that didn't need to see me. Teeth were coming out that didn't need to come out. Maybe the patient should have been in oral surgery or perio instead of endo, or vice versa. And patients themselves were confused and wanted to know more, and they felt like their dentist couldn't explain things to them. And so, I also, all 3 of us, Mark, Tanya, and I, we all volunteer our time at the GPR, the local residency here, and we all teach residents endo. We just go once a month and we try to help out. Otherwise, they have no direction. And I see the way that these dentists are graduating, and when I ask them to give me a simple diagnosis, they really don't even know. Mm-hmm. And how can you even move on to the next step if you don't even know the diagnosis? And they struggle with performing root canals, and 80% of the world's root canals are done by general dentists. And we need to really fix this problem. We need to make sure that there's more education out there. So that was kind of the thought creation and the whole mission behind eSchool, Everyday Endo Made Easy. It's my endo online program, basically to help general dentists get more education in this specialty after they're out of school. Once they've had a little bit more clinical experience, and this stuff is going to make a little bit more sense to them. Mm-hmm. And how can they reapply all of these concepts in a different way that's really going to have a huge impact on their practice? It's going to help them educate their patients. It's going to help them retain their patients. It's going to give them glowing reviews. Their patients are just going to trust them more because they know exactly what they're doing.
Yeah, they're giving them more confidence. I've always said that patients don't come to you for dentistry. They come to you for certainty. They come to you for confidence. Yeah. They want to know I'm in good hands. They want to know that my provider knows what they're doing. Right. Exactly. There's enough uncertainty around dentistry as it is. Like, I don't know if I'm getting a shot. Like, I have a huge phobia of injections. Like, if my dentist will tell you that I'm not a candidate for same day dentistry, right? If you see me in hygiene and I need a crown, there is not a chance I'm going to get that done today, because I need like a week just to prepare myself.
It's always the big guys. Always.
For the injection. I will like I had to get cortisone shots in both my shoulders last week, and I was sweating. I was in the treatment room sweating. She's like, "You okay?" I was like, "Yeah, I'm just nervous." It's like, "Why are you nervous?" And I'm like, "Well, because you're about to give me shots." And she was like, "Oh, it'll be fine." I'm like, you say that, but you're on the other side. I'm on this side. Different perspective. But it's interesting. So by doing with your eSchool and giving more tools to general dentists, you do a couple of things. You help them to provide a higher quality of service to their patients, a better experience to their patients in the form of confidence. You also probably equip them with some of the tools needed for them to do more endo themselves, or to identify which cases they shouldn't necessarily do or don't necessarily want to do, which would in turn benefit you because they send the patient to you.
Yeah. I mean, there's a whole scope. I mean, I think one thing that people don't realize is how much endo they're actually doing, even if they don't do root canals, because the art of diagnosing pain is endo. We're doing way more endo when we are diagnosing, when we're doing pain management, when we're talking about cracked teeth, when we're talking about vertical root fractures, when we use our cone beam, when there's a traumatic case or even resorption. There's so many things in endo that are endo that people just don't realize are endo. They think that they only need to study endo if they want to do root canals. And that is a big no-no in my book, because you're missing out on so many things that your patient are actually wanting to learn from you. And that's step one. That's just like really, truly understanding the concept. If you ask somebody like, what's resorption, they can't really explain it to you. And that's a problem. And I see that every day. Patients don't understand what resorption is. They don't know why they were referred to me. They're a little frustrated with the whole referral process. And those are little frustrations that I want to, put an end to. And then there's, the business of dentistry, right? When it comes to endo, you don't want to have to do a mid-treatment referral. You don't want to start something that you have to punt to the specialist after you've already started it and used so much chair time. So you've got to get good at risk assessment and know what's in your comfort zone. You don't have to do it all. You want to do things that you feel good about, that increase your confidence, that you feel like you're providing really good care for those patients. And then, of course, we want to all decrease the number of redos. It's not just, okay, you got through that procedure, but you want to make sure that that procedure is going to be successful long term. And you need to know what that takes and what are the little tiny tricks to make sure that that root canal never has to be revisited. So that's kind of everything that I cover in eSchool in a nutshell. And it's a lot of in-depth training. And I think people have one outlook on it when they enter the program, and then they go through it and they realize, oh my God, that was way different than what I was anticipating, and a different kind of experience. And then we can always go deeper and deeper, because now I created eSchool Live, which is my dual purpose program, because I want to give back to my community. I want to give free root canals to my community, plus match it with education to the dentist. And, there's only so much you can learn online. My eSchool program is online. You could do it without coaching, or you could do it with coaching. But I will say, when you have me there to help you really understand the concepts, you learn it way more. It's just more than tenfold. It's just crazy, the transitions that I see in people, the transformation.
You bring the dentist into your practice and have them do endo there, and then you coach them through the procedure, or do you ever go to their practice and coach them through a procedure?
No, they all come to my house. Everyone comes to my home, and I take care of them in my home. But the coaching, there's an online form, and you have to go through the online version with coaching first before I allow you to come to my house and do the root canals on real people. And so this is a live patient hands-on course, but it's also a give back program. So the patients are basically only paying $100 to reserve their spot. That we just need to, they have some skin in the game to show up for that appointment. Okay. But, and the patients are so grateful. They cannot believe that like a program like this exists. They're really, really happy, because it saves them thousands of dollars. It really does. And then the dentists come to my office and they use my equipment and they do the work. So they take what they learned in eSchool with coaching and they actually implement it on the patients. And they're learning, they totally master things like warm vertical condensation by the end of the weekend. And they really understand access. They use my microscope so they can see, oh, if I love endo so much, maybe I want to incorporate something like this into my practice. And then again, they're building this different level of endo knowledge that they just didn't have before.
Mm-hmm. Is without getting into fees and all that kind of stuff, is it like the online platform, is it like a subscription kind of a thing? Like I put a credit card on file, it charges my card X amount a month, and then I get so much access per month. How does that, what's the work look like?
You buy the course one time and you actually get lifetime access to it, because I want people to be able to go back over and over and over and watch the content. And I don't want them to have to worry about money. I really want them to just learn, because that's going to translate to their patients, and that patient is going to deal with that tooth one time and that's it. Right? Mm-hmm. They don't need to keep paying for the same tooth over and over.
Yeah. Did you hire like a software developer to build the platform, or is it like a website with like a complex back end? Is it mobile? Is it like a mobile app?
Yep. It can be on your smartphone. It could be on your computer. You could do it from anywhere in the world. You could do it by the pool. You could do it when your kids are going to bed. You can do it when you're on vacation. I mean, whatever, like from wherever, whenever. Totally on your time. I mean, the coaching calls obviously are scheduled, but when you are consuming the content, you do it totally on your own time. You don't have to travel. You don't have to close your office. You don't have to lose that production. You do that content consumption on your own time. And then you meet once a week.
Yeah. So the eSchool is like, this is recorded videos. I go in and watch the videos.
Right.
And then there is some interaction to some degree. And then the live is where I come into your practice and I see patients with you in your practice. Is there is any component of the online portion virtual, where kind of like what you and I are doing now, except there's a patient next to you and I'm also here virtually?
No, it's not like that. We're really discussing the concepts and going through people's cases that they had that week or that day. So it's more like case presentations type thing. How can we tweak this and that? There are recordings of me working on patients so they can see that. I just actually created that, and I'm going to be putting that in for even people who previously purchased. They'll get access to all that. So even when I update the course, you'll get it even if you buy it now. Does that make sense? I'll update it and then I'll release it to anyone who's bought in the past.
Interesting. When did you launch that? How long have you had that?
March of 2019 is when I launched the courses, but I launched my blog on my birthday. This is a lucky day for me.
Yeah, you do stuff on your birthday.
In 2017.
Interesting. And you have people, are most of your students, are they international? Do you have students from other countries? Is it mostly US?
Yeah. I've had students in the UK, Qatar, Nairobi, Australia, Canada, States, everywhere.
How do you speak multiple languages?
I don't. We have launched in Japan. I do have an excellent endodontist who has translated eSchool in Japanese, and he coaches the Japanese client.
Wow.
Yeah.
That's really interesting. That's awesome.
Yeah. I'm in India too, but I didn't need to translate that.
Right. So you're going to wind up having like 15 eSchool in 15 languages.
Hopefully. Yeah. That's the goal. Yeah. We have a few in queue. Still, I would like to find a coach for those. So working on that. Slow organic growth is what I need. Otherwise, things get a little out of hand.
Be the one? Yeah. Do you plan to always be the one coaching and providing the instruction and doing the courses, or do you plan on like recruiting endodontists to lead courses and do the coaching, like hire coaches that work under you?
I think if it keeps growing the way it's growing, I am definitely not going to be able to do it all myself. And so I've already talked with Mark and Tanya about joining in. I know how they work. We all work the same. I believe in their clinical skills. And so that's probably where I would venture next.
would you step out of practice ownership and do this full time, or would you put people in this to cover the responsibilities there and practice more? Balance.
I am actually working on going down to 1 day a week at my practice so I can put more effort into teaching, because I really feel like that's where my heart is at.
Right. I like it.
Yeah. I'm already working only 2 days at my practice, but I think one is good because I like the managing side of my practice and the visionary aspect of it. And then just one solid clinical day where I can just keep my hands wet, and then the rest in teaching.
I like it. Is Vivek a student?
No.
He better be. He should have been your first student. Be like, listen, you're going to have to sign up.
Listen, he should be my number one referral, and he's not.
He should be. That's exactly right. He should be.
Right. You know, I'm going to let you tell him that.
I'll do that. Well, I'll relay it to Reagan. I only see him once a quarter. And that's whenever we're at the training university and we're sitting around talking about DSOs and buying and selling practices and all this stuff.
Yeah. Well, you should let him know. You should let him know that you should take care of wifey.
I certainly will. He's going to ask for a discount. You going to give him a discount?
Maybe. Just maybe.
I got a question for you. Actually, so if someone were interested in getting involved in your eSchool, would they, because you're on Instagram, I think I've seen your Instagram page. What's your Instagram handle? It's
Sonia Chopra DDS. That's Sonia with an I. SONIACHOPRA DDS. Yeah.
And you're on Facebook. Yep. Is there a website that they can go to?
Yep. It's SoniaChopraDDS.com.
Oh, so it's all okay. Good. So it's all the same.
All the same.
Good. And then if you might want to throw your email out there too, just in case, to make it kind of easy for folks if they want to, or is there a contact form on your website?
There's probably a contact form, but you could just email Sonia at SoniaChopraDDS.com.
There you go. Makes it pretty easy. Yeah, that's really easy. I got a question for you, just curiosity. Would you say, because most general dentists focus more on like anterior premolar and they stay away from molar endo, is that more because, and this is just my ignorance, is that more because ergonomically molar endo places kind of more stress on your neck and your back and that kind of stuff? Or is it the complexity of the endo itself?
I would think it's the complexity, but there's plenty of dentists who are doing a lot of molar endo. Plenty. Yeah. So, but I always want people to do endo their way. Like if something stresses you out, like listen to your body, feel that. If you don't like that, if you don't like the length of time it takes you to do a molar, then again, here's business of dentistry. Like don't do things that you don't like. And don't do things that are going to take you too long. If you can bang out, a few crowns faster than that one molar root canal, that's going to be more of a productive day. And that's something that you should punt to your specialist. So again, learning the way you want to work within endo. And some people are totally fine referring everything out. And there's no shame in that either. And that's great. People are like, I really don't want to make the investment in the equipment. I don't want to, I just don't like how I feel when I'm doing the endo. I'm way more comfortable doing, an implant. That's what they prefer to do. Not saying that you should take the tooth out to do the implant, but you would rather have an implant on your schedule than doing the root canal, and then you can refer that out. So it's really important to know how you like to work and how you make endo fit into your life. But that's why I really like to stress to people that even if you don't do any root canals, you're still doing endo every single day. And if you don't have that base knowledge, then you're likely losing money somehow, somewhere. And usually we see it on our end, or the patient wants to leave their dentist because they weren't educated enough. And I have about 2 to 3 patients a day that ask me for a new dentist. It's the most uncomfortable conversation. And I hate having this, but I'm always trying to, get people to understand where their dentist is coming from. Like the people who are like, well, it didn't hurt me until my dentist touched it. You've got to know how to prevent that conversation, because that's the conversation they're having with us in our practice. And you need to have a good relationship with your specialist so that your specialist can come and tell you that, hey, this is what's happening. Does that make sense?
Yeah, makes perfect sense. What about guided endo? And again, this is my ignorance. I want to learn. I'm curious because I've heard about this. I'm not familiar with it at all. But from what I understand, it's basically it's like computer assisted endo.
It's very, like, the learning curve on it is crazy. Now, is it the future? Absolutely. But are we there yet? No. And even amongst endodontists, there's only like a handful of endodontists who do it. And they're saving it mainly for those really calcified cases. But you have to have a very steady hand to make sure that you're not even like half a millimeter off.
Right.
So that you go in the proper path. It's neat. The XNAV and those kind of things, those are really neat endo toys. And hopefully one day I'll even put it in my practice. But I'm now starting with the Gentle Wave, and I've been using it for 2 years and loving it. And I just have to still do those calcified ones the hard way.
Right. Do you think that's going to make it easier for general dentists to do more endo, or is it just a learning curve? Do you think it's just not, maybe not?
I think it's cost prohibitive, because you look at something like the Gentle Wave, which is pretty easy to use once you get it, like, it takes about a month to figure it out. But, even something like the Gentle Wave, which I feel like everybody should use because it really does clean. It's just not cost effective for someone who's doing one root canal a week.
Right.
Right. I'm doing 8, 9 a day.
Right.
That makes sense. Where, somebody doing one a week, that's not really worth it to spend $80,000 on a machine.
Very good. I like it.
Yeah.
So I've taken up about 90 minutes of your time. I know you've got more important things to do than talk to me on a Zoom meeting.
Never.
But, I am grateful for you taking the time to spend with us today.
Thank you.
And then obviously anybody that wants to get in touch with Dr. Chopra about her e-school, or if you want to refer her a patient, I'm sure she would be grateful. And it's www.soniachopradds.com.
Yes.
Sonia with an I.
Thank you.
And then email is Sonia at soniachopradds.com.
You got it.
Fantastic. Well, thank you so much for spending some time with you today. I'm grateful. And I look forward to seeing you over in Charlotte sometime in the next couple months.
Perfect. I'll see you then.
Have a great day.
Take care. Bye-bye.